Hi, I'm Alison Carney, the chair of the Anaesthesia Research Coordinators Network, a network made up of more than 160 research coordinators facilitating anaesthesia research and clinical trials here in Australia and in New Zealand. Research coordinators are the heartbeat of the ANZCA Clinical Trials Network and are at the coalface of clinical trial activities, facilitating the consent and recruitment of participants. With the wealth of expertise behind them, coordinators are always ready to act, no matter what the situation presents. On reflection, 2020 has been a very challenging year for our coordinator workforce and the greater clinical trials network. Many research coordinators have found their roles affected by the suspension or slowdown of clinical trials and a reduction in their working hours. Some have also faced redeployment to clinical work to support the national pandemic response. Despite the challenges that 2020 has thrown at us, the network has responded with courage, unity, resilience, and innovation. We've celebrated many milestones, including welcoming many new research coordinators into the fold and celebrating International Clinical Trials Day in May. Our research coordinators across many sites have been busy getting new ANZCA CTN endorsed trials up and running, including both the VAPOR-C and the TRIGS trials. We have also welcomed brand new sites into the CTN, with the Queen Elizabeth II Jubilee Hospital in Queensland commencing the POISE-3 study. One of our rural sites, Goulburn Valley Health in Victoria, has also featured in the local news in a story encouraging patients to get involved in CTN trials. There have also been many trial recruitment milestones celebrated across many sites, including my very own hospital, Princess Alexandra Hospital in Brisbane, who has now recruited over 100 rocket patients and over 60 POISE-3 patients. The Royal Adelaide Hospital has this year recruited their 150th POISE-3 patient, a Herculean effort, and the Women's and Children's Hospital in South Australia has recruited 100 hamster patients. The CHEWI study has now topped over 100 randomised patients out of 375 enrolled, and ITAX is halfway through their recruitment with over 500 patients. Rocket continues to also steam ahead with over 1,500 patients recruited in total. We've also continued to provide vital learning, networking and mentoring opportunities of our research coordinators by running monthly in-service sessions. June was an important month in the life of our network as we ran our inaugural virtual workshop, which also was our largest to date with more than 90 online participants. On the networking front, our Western Australian coordinators were lucky enough to have their first catch-up and mentoring session with no social distancing required, and a great time was had by all. Our network has led the charge in adapting to a rapidly transforming clinical trials landscape. We've changed the way we run trials to continue to deliver world-leading clinical research, and many sites have stepped into COVID-19 research. While some coordinators have had the opportunity to work from home, for many this has created a whole new set of challenges, but equally new opportunities in expanding our capabilities in telehealth and streamlining our trial processes. In the near future, we look forward to hearing the results of the landmark CTN PADI trial. This was a very large trial with a large number of our research coordinators heavily involved, and I know we all eagerly await these results. In the new year, we look forward to planning our newly funded trials, Lollipop and TRIGS, and getting these also underway. I think it would be very fair to say that despite the curveballs 2020 has brought us, we are and will continue to always be clinical trials ready.